With iowapodcast.com, I'm Justin Brady, and one of the things it just drives everybody crazy is how annoying healthcare is to work with. Like, takes months to get in, they spend 30 seconds with you, it's a broken model, and there is an Iowa-based company that's fixing that, and that's who we welcome today. It's Carl Behne, of course, the co-founder of Hy-Vee Health Exemplar.care. Carl, thanks so much for coming on the show.
Thanks for having me.
And so you guys have created a new/old model that's absolutely fascinating. What's the way to break this down for someone who's like in high school or middle school? What would you tell them?
I would just say it's what you think healthcare should be. It's time spent with your provider. It's easily accessible, and you're able to talk about the things that you want to talk about in an unrushed way and in a way that your provider can drag kind of additional information out of you because they have that time to spend with you. And ultimately, it leads to a better outcome for you. And ultimately, that's what you want as an individual, is to feel good, live your best life, do the things that you enjoy, whatever that is. It may just be reading, maybe knitting, maybe playing outside and golfing or being with your grandkids. But at the end of the day, no one really knows that but you. And the only way to get to that key end spot and live that kind of best life with your healthcare is to really have someone that can spend the time with you to go through all those things. And that's the best way that I describe it. There's a lot of nuance to it, certainly, but it's really just taking care of your body in a way that works for you.
You mentioned time in there, like probably maybe 3 times, I think. I'm going to explore why this model you've developed actually spends more time with patients, why that matters. But is the term direct primary care, because there is an industry term for this.
Absolutely.
Is that the official term, direct primary care?
It is. Yes.
Okay, that's the official term. People are complicated. Like you said, you need time spent with people because you need that time to pull things out of them. Describe that a little bit.
Yeah, so I would first start with, and we don't have time for a long history lesson,
right,
but at the end of the day, insurance was intended to deal with those catastrophic things, the hospitalizations. Way back in the day, insurance was not designed for you to have an interaction with your physician. And, back then there wasn't nurse practitioners and PAs, but it was you and a physician having that relationship. Now there's multiple levels of providers that you can have that same relationship with.
Mm-hmm. Mm-hmm.
But insurance was there for the catastrophic. And we morphed that into everyday things that you need. And I kind of tie it to like car insurance in today's world of you would never think to turn in your gas receipt, your wipers, your oil change, your car wash to State Farm or Progressive. You just take care of those things.
Exactly.
You have that relationship with whatever industry company that's taking care of your car with you so you can drive it and do the things you want to do with it. Your body is the same way. We were really intended to take care of 80 to 90% of our personal health care in that way, and then have insurance be there for the cancer, the car accident, the bad sports injury when you're a weekend warrior or a young athlete, whatever it may be. But we've morphed that into everything has to run through our insurance, which then leads to kind of poor decision making because you don't know what the cost of something is.
Right.
And then with that and that ambiguity of that price, you end up taking a step back and going, I probably really don't need that right now because I don't know what's going to cost me. So let me kind of ride this out.
It worked. Yeah, it had the opposite effect.
Absolutely.
Yeah, that's a good point you bring this up because people almost don't know the difference between healthcare providers, like hospitals, clinics, your doctor, and health insurance. They're all kind of merged into one thing. And as you correctly point out, we wouldn't ask, Progressive or Geico or Nationwide or any of these companies to cover oil changes. And but people in healthcare, they don't know what entity is responsible for what. It's just like, if I get a paper cut and I go in, that should be covered by insurance. And so you guys are on the care side, not the insurance side, but there's also a partnership with Molina. Can we briefly touch on this new thing and what this means for your patients? And then I also want to talk about why patients kind of feel exploited. And so why should they be listening to this conversation at all?
Yeah, absolutely. So at our core, we're a membership-based organization. You pay that fee, you get that access to that unlimited primary care, that 80 to 90% of your life. And so one of the things that we found and why we partnered with Molina is access to care is difficult in our current confines of healthcare. And so getting those very complex, oftenly socially, economically challenged individuals, they don't have the resources to tap into people and things to direct them to where to go. And so when they don't have that, they tend to drift into more costly care when it's not needed, or they delay care because they can't access it, and then care becomes more costly. So obviously Molina is managing a very complex population of individuals. Rather than the traditional fee-for-service come-in transactional relationship, we have a partnership with them where they have a group of lives that are unassigned to providers. They assign them to us. Ultimately, then we deliver that care. Those people get membership basically as part of their benefit through Molina.
They do?
Yeah, so we end up serving them no different than if you or I had membership, or some other company in the Des Moines Metro or across Iowa or across the 5 states we're in are purchasing that membership. So Molina is basically purchasing that membership because they know, let's be real, they're a for-profit company. They're, a publicly traded company. They have stockholders to be held accountable to. They need to turn that profit. And so they're looking at ways that they can save dollars in healthcare. Mm-hmm. And the best way they can do that is getting their folks to easily accessible primary care and to people that can then direct that care to more cost-effective locations when they do need downstream referrals.
Yeah, and see, this is the thing that people don't understand when it comes to healthcare and insurance. They don't understand. I've had this conversations more times than I can count, which is people are like, why is my health insurance company not covering preventative visits? Like preventative things that actually should lower my, lower my liabilities. I don't know what the right term is. Like, why are people ignoring that? And so Molina is basically saying, yeah, we're not going to ignore that because we actually save money if we give people increased access. Like, this is kind of what they're doing. Yeah. So I want to go into, people kind of feel exploited by healthcare, and they should. Mm-hmm. We've talked about this with Dr. John, talked about this with you off camera, of course. So do people really believe you at all when you say like, oh yeah, unlimited visits and our plans start around $49 a month? Like, do people believe any of that? Or do they're just like, oh yeah, key word there, Carl, is start at. And then the second we come in there one time, it's going to be $10,000 bill from your new headquarters on Mars.
Yeah.
So how do you convince people that you're not full of it?
Yeah. Certainly the first response is it sounds too good to be true. And that's actually sad. I mean, that's part of what's wrong with healthcare today, because it really is that easy. It really is that simple, and it really is that affordable. So we do have those comments from folks. We try to walk them through that journey. Oftentimes we'll, we might even give them a trial. Say, come feel what the experience. Absolutely. Come feel what that experience feels like, of what real healthcare should feel like for you. And quickly they're pleasantly surprised and they move into that world, and then they're telling more people, or they won't maybe believe us right away, and they'll talk to somebody who has had that experience with us, and then they have that second source, and they're like, okay, this let's give this a try. Because at the end of the day, everyone wants that accessible healthcare. They just don't believe that it's really there, because right now you call to get an appointment to a provider that maybe you've been seeing for 5, 6, 7, 8 years, and you're not feeling well today. It could be 5 to 6 weeks before you get in to see them. And then ultimately that leads to the behaviors that we have in our country today of overutilizing urgent cares, overutilizing ERs. It's not that we don't have enough people to take care of them right now. It's just we don't have the right things in place to be able to take care of those people. So the processes that have been put into place ultimately lead to just then consumers demanding the access, and they go where people provide it. And so you have the urgent cares and everybody else that pop up and ultimately lead to fragmented care because it's not everybody's communicating. You go to the urgent care this month in West Des Moines. A month from now, you're down in Texas. The following month, you're over in Davenport. You've now seen 3 different providers on 3 different systems. They don't know anything really about you other than what you tell at that moment. And you're not ultimately probably getting to the core problem of whatever's going on with you.
Yeah, you bring up a good point, because a lot of people who don't know how to look under the hood of healthcare don't actually know how inefficient it is. And I remember talking to some consultant, and he's like, all I did was go to this hospital. He's an efficiency, planning guy, whatever. It's too long to get into here. But he's like, all I did is sit in this hospital and just for days and just would watch what people did. Because I realized that 60 to 70% of their time fit into this time category he called looking for stuff. or trying to chase down information. And he's like, they were burning so much, like doctors themselves were spending over 50% of their time just writing reports and entering data in. And so he was like, you're like, you don't know it, but you're screwing over your patients because you're spending all this time on things that you're really inefficient over here.
Yeah.
So we have the inefficiency thing, which you guys are solving. And we also have the fact that there are some companies who will go unnamed that do tend to make a lot of money in the gray areas, right? And so in the gray areas of inefficiency, some people are making money. So I do have to ask, and I'm going to ask about time spent and what that looks like with the last question, but I do have to ask, are there some people that are a little ticked at you for making this model?
Yeah, I think there's folks out there that, would prefer that we didn't open the curtain to show that there was a lot of middlemen that are involved. At the end of the day, the rate that we're charging ends up being the cost structure of other administrative programs and burdens within health plans. And it's like you're spending more on that than what you could be on the actual care with a provider for an entire month unlimitedly, for an entire year unlimitedly. So that, it gets frustrating for us, but we know it's the challenge within the system we operate. We kind of trudge forward and look at the ways that we can impact, and we educate our either members or future members, and we're gaining traction. But yeah, there's certainly people kind of in that middle ground that can kind of scrape from the insurance side, from the provider side, and kind of anywhere that there's loose change to pick up. And there's a lot of loose change, we'll call it, in the middle in healthcare. And so they do quite well for themselves.
So at Hy-Vee Health Exemplar Care gives someone a walkthrough, like they're paying a monthly fee. You say it's just a monthly fee. It's unlimited visits. Like what does that look like for them? They call, they just show up. They call. What does it actually look like? They pay a monthly fee, and then what do they do?
Yep. So we'll pay the monthly fee. We obviously get you in, get you welcome for that first appointment. We're gonna, your provider's gonna go through just kind of where you at in your health and well-being. What are your goals? That's part of it too. Not just not what's going well for you right now in this exact moment, but where do you see yourself? How do you want to better yourself? Maybe again, you're in your mid 50s and you're getting ready to have grandkids and you want to be active for them. So what kind of things should you be doing to make sure you're going to be living your best life towards the end of your life? And so we're going to spend that time with you. You're going to leave. You're going to have direct access to your provider, basically either via secure text messaging, emailing, portal message, phone calls, telehealth, however it works for you. And as you work on that plan, you can ask for immediate feedback so you can have that connection point. Maybe you're not that person, you just want to grind through it and you're going to stop back next month and check in. Again, that's up to you. So it's really tailored around you. But then we're going to sit there and, be able to fill your meds for you, coordinate those medications for you. If you're on any, you can contact us if you run out, something's not going well. At the end of the day, it's just really making all the things that you do around healthcare super simple. And again, you wake up in the morning, 6 a.m., you're not feeling well, you need to get somewhere by noon. What's the likelihood you're going to get in somewhere and get taken care of?
Yeah.
And somebody that's going to know everything about you, really hard. And do you have to remember all the things about your health for that quick 15-minute appointment at some urgent care or some ER across town? No, you just call. We take care of you, whether it's your provider or one of our other providers that's available right then when you need care. So again, it's really just truly care tailored for you.
Yeah.
So you don't have to try to fit within our system. We want to fit within your life. And that's been part of the healthcare problem is we expect people to fit into our world. Just like there's lots of great providers out there, to your comment of really inefficiently doing things. That's not what they signed up for.
Right.
I mean, they went to school, they grinded a lot of years of their lives to take care of people. And now they're stuck in this machine that inhibits their ability to truly do what they're passionate about and taking care of people. And they're just a cog in the system, unfortunately. And we've tried to pull ourselves and people out of that system. So there's no longer all those barriers between you and the patient in the way that you interact.
You're basically scaling the idea of the small town doctor that you had on speed dial and you knew personally. Carl Behne, the co-founder of Hy-Vee Health Exemplar Care, and that is exemplar.care. Yes, that's a website, exemplar.care. Carl, thanks for coming on the show again.
Thanks for having me. Pleasure.